Hi everyone, so today I'll be talking about neonatal feeding problems and I'll start with my case study. Matt is a 2-month-old boy who was born at 36 weeks of gestation and has congenital heart disease. He is getting ready to be discharged from the NICU and he is transitioning from a neogastric tube feeding to breast or bottle feeds. He tires very easily as a result of the congenital heart disease, and his mother actually reports concerns about him not gaining enough weight after the transition. She does report that he's trying to latch on the nipple, even though he has difficulty maintaining that latch. So some concerns I'm having for Matt includes the increased fatigue as a result of the congenital heart disease, and then that his suck and swallow reflex might not have been developed enough for his age, as he has always been fed through an NG tube. However, some of the strengths that I have noticed from Matt is that his mother is very involved, and she reports that there's a great family support. Also, Matt has a good rooting reflex, which will facilitate his ability to find the nipple in order to latch. 3 characteristics of neonatal feeding problems that are prominent for Matt include: number 1, an undeveloped suck and swallow reflex, because he's been fed through an NG tube and has not had the opportunity to develop a strong suck, swallow, and breathe pattern, which is necessary to feed from the breast or a bottle. The other characteristic is the existence of behaviors such as resting and sleeping during feeds. Matt presents with reduced alertness as a symptom of the heart disease, making him present behaviors of excessive resting and sleepiness during the feeds. And the third one is the readiness for oral feeds. Infant is in the early stages or transition from neogastric tube feeding to the breast or the bottle. This will create a problem latching and maintaining the latch. 2 of the frame of references that I have chosen to base my interventions for Matt include the Synthesis of Child Occupational Performance and Environment in Time, or SCOPE-IT. This one enhances childhood occupations, and feeding is the main occupation of infants. In addition, the SCOPE-IT allows OT practitioners to create intervention plans that adjust to the infant's environment. The second frame of reference is the Occupational Therapy Intervention Process Model. This is a top-down, client-centered approach, and it adapts or modifies the task in order to maximize the infant's occupational performance. These 2 assessments, I think, will be helpful, and they will guide me through Matt's intervention planning. The first one is the neonatal eating outcome, and this assessment is actually recommended to assess oral motor function. It aims to ensure the infant's ability to feed safely, or it makes sure that there's no need for any supplemental feedings, like going back to the NG tube feeding. One weakness of this assessment is that it does not provide any treatment interventions. And because Matt will be transitioning from the NG tube to bottle or breastfeeding, there is a need to ensure that he is safe and that his mother feels comfortable during this feeding time. The second assessment that I chose was the Neonatal Oral Motor Assessment Scale. This one assesses the oral motor patterns related to feeding problems during the neonatal stage. This assessment also focuses on the jaw and tongue function. For Matt, this is a good assessment because, as him being a premature infant and not having had any previous activity that involves the facial muscles, we must know that some of the deficits could be an issue for Matt to demonstrate a strong latch and an appropriate suck and swallow reflex. Now, the 2 occupation-based outcomes that I'm predicting from Matt are that Matt's suck and swallow reflex after latching on the nipple during the bottle or breast will improve with the use of non-nutritive sucking and sensory motor interventions. The second one is that his ability to remain latched on the nipple will improve as a result of compensatory and positioning techniques that will be that the education will be provided to his mom. And lastly, to conclude, the goals that I have chosen for Matt will be that Matt will demonstrate increased suck and swallow reflex as evidenced by ability to feed from the breast or bottle during 3 out of 3 feeds for 3 consecutive days, 5 minutes after engaging in non-nutritive sucking within 8 weeks. The second one will be that Matt will be able to maintain the latch on the breast for 10 minutes during 2 out of 2 feeds per day while his mother feeds him inside laying position within 8 weeks. And that's pretty much it. Thank you.